Hi everyone, my name is Dr. Michael Wald, the Blood Detective, and welcome to this very important conversation regarding misdiagnoses, which I've entitled 12 Million Misdiagnosed. Could this be you? So during the next 10 minutes or so, I'm going to let you know about misdiagnoses and its prevalence in the United States, and how you can spot misdiagnoses and why they occur, and some other practical information. So I'm a doctor of chiropractic with a board certification in nutrition. I also have a master's degree in nutrition. I'm a dietitian and a sports nutritionist. I also have a medical diploma, but not an active license to practice medicine. So let's begin with a disclaimer that this information is not meant as a substitute for sound medical or health advice. It is for your education. So please use it wisely. So the reason that I titled this talk 12 million misdiagnosed is because an estimated 12 million Americans are in fact misdiagnosed every year. 12 million, that is a lot of people being misdiagnosed, which means the follow-up therapy for those misdiagnoses are always wrong. Studies suggest 1 in 20 adult outpatients receive a diagnostic error annually. And finally, nearly 1 in 3 people will experience a diagnostic error at some point in their lives. So the chances are you will have already been misdiagnosed, or you will be soon. Let's talk a little bit about mortality and harm from misdiagnoses. So diagnostic errors contribute to 40 to 80,000 deaths per year. Can you believe that? 40 to 80,000 people die because doctors are simply getting it wrong. Sometimes they're just not being conscientious enough. They're not thinking. They're rushing. They are bad at what they do. They may have been the best student in medical school, but clinically they are not particularly good at diagnoses. So there's many different reasons, but that is a startling number. Missed or delayed diagnoses are a major cause of preventable harm in hospitals and outpatient settings. So just better medicine, and not just by the doctors, but by nurses in hospital settings. And of course, there's plenty of misdiagnoses in the outpatient, out of the hospital setting as well. Conditions like stroke, sepsis, which is an infection, and cancer often result in serious injury when not diagnosed properly. But any health problem that you have, if not diagnosed, is a serious issue as far as I'm concerned. So what are some of the conditions that are commonly misdiagnosed? I've seen this through my 33 years of clinical practice, particularly holistic practice, because when you practice holistically, and I'll discuss this in a few moments, you just see things differently. You see more, in my opinion. You see more pieces of the puzzle as opposed to when you're not thinking holistically from a diagnostic perspective. So cancer, cancer of the lung, the breast, colorectal cancer, melanomas, very commonly misdiagnosed. And part of the misdiagnosis is delayed diagnosis. So you don't know you have these problems, and by the time they find them, it may be too late for you. Then infections, such as serious infections like sepsis, pneumonia, and meningitis, all have been and continue to be misdiagnosed. And then vascular events like stroke, myocardial infarction, heart attacks, and aortic dissection, where there's a tear in the aorta, and it dissects is what that is called. And also autoimmune diseases like lupus and multiple sclerosis, although autoimmune diseases are tricky and they are commonly misdiagnosed. And then there are various mental health conditions. Failure to make a diagnosis of bipolar disorder may be misdiagnosed as depression, for example. Other disparities in misdiagnosis include the following. This is important. Women and minorities, they face higher rates of misdiagnosis. For example, in heart attacks in women. Heart attacks in women are initially commonly blown off as, oh, that's just anxiety, or you have indigestion, or you have heartburn or reflux or something like that, when it is not that. And then there are language barriers. Lack of cultural competence and implicit bias contribute to disparities. In other words, some doctors don't take people of certain backgrounds, ethnic backgrounds, seriously. And then black patients, some studies show that they're less likely to receive timely diagnoses for diseases like multiple sclerosis and melanoma and many others. Now, don't get me wrong. There are many good doctors, both male and female, that are not biased or prejudiced or racist in any way. And they're still making tons of misdiagnoses according to statistics. So what are some of the solutions that you should be aware of for misdiagnosis? Well, one, we want to promote team-based diagnostic review and second opinion. So you can always get a second opinion if you're not satisfied with the first opinion. And you would hope, and you might want to ask your doctor or the hospital setting, how do you deal with complex patients? Do you have ground rounds? Do you have different types of doctors sitting around at the table talking about cases? Because you're going to probably reduce the rate of misdiagnosis if you involve other brains. And the next thing is to use clinical decision support systems and AI tools to enhance pattern recognition and reduce bias. So, for example, I had developed a software program that medically and nutritionally interprets laboratory work very quickly. Both it also talks about drug interactions and food suggestions for the person's chemistry in just minutes. And I developed that over 20 years ago. I remember speaking with a woman who is a cancer specialist, and she seemed very disinterested in my program. And I asked her why. She says, "I like to do things the old-fashioned way." I said, "With your cancer patients, you're not going to want to use technology?" And it had nothing to do with me selling the program. I was just startled that she somehow thought that her brain could outwork a computer program. You can always keep your brain, but then use a computer program. So we have this bias too around doctors are comfortable with how they're doing things, and they don't make the proper strides in their knowledge and use of the tools that are available. And the next to reduce misdiagnosis is to train clinicians in whole person, or what's known as functional medicine and integrative diagnoses. So the functional perspective or functional medicine is just a term that is very similar to holistic health, and I know most of you have heard of that. And it basically involves considering the entire patient as a whole. Now, what does that mean practically? That would mean for me as a blood detective, when I see a client and they have certain symptoms, I will do testing from most every system that they have. I might check in the endocrinology area, the gastroenterology area, the internal medicine, family practice area, the gastroenterology area, the toxicology area, whatever it takes to uncover what's there. But most doctors, they do not work that way. That's not how they're taught to do things in medical school. They do specific limited tests for their specialty. Therefore, medicine is compartmentalized and it misses a lot. I can go on more about that, but I think you get the basics. And then you want to encourage patient engagement, self-advocacy, and transparent error reporting systems. Now, let's face it. Your doctors, generally speaking, they do not want your opinion about what errors they may have made, or you self-advocating. They'll tell you, "We don't have time. We only have 10 minutes today to talk about this." But you need to insist on being heard. So you want to engage in your health care. And you want to advocate for yourself, because if you don't, who will? So what is a better approach that should minimize the onset of misdiagnoses? So I believe it's a holistic approach, as I just mentioned. So for example, a holistic approach evaluates the entire person. Now, not just, I'm not giving lip service to this holistic idea. In actual practice, at least the way I practice, I will do testing in all areas of medicine. I will ask questions, detailed questions in all areas, as many as I can in terms of one's health, even if they're coming to me for something that seems to be limited to one area, because there always are connections. We want to know about that, but if you don't think holistically, you simply won't do that. And that's how regular doctors work. And my blood detective software program enhances lab interpretation. I just mentioned that the system took me years to put together, and it very quickly and accurately interprets large amounts of laboratory data. Then I review it. So it's like having multiple people look at lab at one time. So this is using technology to help us get smarter. And many doctors are just old-fashioned in their approaches. It's difficult for anyone to change their habits after they've done something a particular way for a long period of time. But those of us in healthcare must do this. Functional analyses uncovers patterns and root causes often missed by isolated organ-specific testing. So that's basically what I said on the first point here. So functional analysis means looking at the interrelationships of different things, or seemingly different things. So if someone comes to me and they are, let's say, gaining weight. Now, I do a test on them called the bioimpedance test, and it tells me the percentage of water, fat, and muscle on them, or lean mass. And I notice that their lean mass is very, very reduced. Now, that usually means that the person will have less stress upon their bones, and they might have osteoporosis. So there's a relationship between loss of lean mass and weight gain and osteoporosis. And to take it further functionally and holistically, there may also be deposition or the laying down of calcium from the bone in joints causing arthritis, because that's what arthritis is. It's calcium deposition in joints. And finally, some of that calcium from the bones could be laid down on the inside of blood vessels, causing atherosclerosis or hardening of the arteries. So a functional assessment of a person looked at their fat percentage, loss of lean mass, which may mean that they might have loss of bone mass, and loss of bone mass means calcium's coming out of the bone, and then functionally, holistically, we think, well, where's that calcium going? On the inside of blood vessels, stiffening of the arteries, or the inside of joints, which is arthritis. So that's how the functional holistic process works. That is several steps beyond what many doctors who specialize in any one of those areas would do. We want the practitioner to be conscientious and have an investigative mindset. So I'm not nicknamed the blood detective for no reason. A patient who had been misdiagnosed and underdiagnosed for many years came to see me, and I diagnosed her in something like 2 weeks with a very serious health concern, which we were able to successfully treat. And her husband said to me, "Dr. Wald, you're like a blood detective." And I thought for a second, yeah, that I can stand behind that. So of course I trademarked that, I registered that, and I live by that. So that is my conscientious structure. And also, the practitioner should be empowering patients to engage in activities to improve their health outcomes. So we want to give people not just general advice about health, we want to help them actually implement it. And also, what is the use of me giving advice to a person if it's just too difficult to do? So you always must assess the person and where they're at. And this is all part of how to diagnose someone properly. And finally, I would say one way to help minimize, or a few other ways to help minimize misdiagnosis, is to use natural methods first if the condition or conditions allow for that. Because even if you misdiagnose someone and you're using diet and nutrition, you're going to cause far less harm than if you start with medications. Now, if the symptoms and conditions and the judgment of the doctor is such that they think that medication is the first best thing, which they always will practically because they're not trained in nutrition, then that's one thing. But that's why you might want to see someone who's both holistically oriented and who has knowledge in medicine and the medical approach, so that they can choose the least harmful treatment first. So I hope that made a difference for you today. It certainly made a difference for me reviewing this with you. It'll make me better, and I hope it makes you healthier. I'll see you at the next podcast. Thanks for attending.